The activity card sort allows occupational therapy practitioners to help clients describe their instrumental activities of daily living, low and high demand leisure activities, and social activities. The information obtained by administering the ACS will provide clinicians with an occupational history and the information to help clients build routines of activities that are meaningful and healthful. There are 3 forms that can be used for the ACS. Form A, the institutional version, is used in hospital, rehabilitation, and skilled nursing facility settings. It is used to get a sense of a client's activities before hospital or rehabilitation facility admission and prior level of function to use as a base for planning intervention strategies. The recovering version, Form B, is used once a person is home and receiving outpatient or in-home services. It is used to detect changes in activity patterns, and it is possible to determine what the client did before the illness or injury, and if he or she continues to do, does less, or has given up the activity he or she did before. Form C, the community living version, is used when working in the community population for clients ages 60 or older. It does not assume the client has an illness or injury that requires specific treatment. It is used to see the client's change in activity pattern as an older adult. The ACS can be used with adults ages 18 and older and is suitable for clients with or without impairments. Some populations tested have been cancer patients, patients who have had a stroke, traumatic brain injury, or spinal cord injury. The following is a video demonstration of the activity card sort recovering version B.
Hi, Mr. Campbell. My name is Rachel. I'll be your occupational therapist today. Do you know what occupational therapy is?
Yes.
Okay, great. So today what we're going to do is an assessment called the activity card sort. And I know that you are receiving outpatient services, outpatient occupational therapy services after your injury. And so what we're going to do is we're just going to do this activity so you can place these cards in different categories. We're going to kind of use it to detect changes in your activity preferences and in your activity patterns, and see what you used to do before your injury, what you still do after your injury, and maybe set some goals for therapy involving these activities, okay? Okay. So, what I've done is I've placed 5 categories in front of you, and we're going to sort the cards into, I'm going to have you sort the cards into each one of these categories. We are using the recovering version B of the activity card sort. So what I want you to do is look at these labels. So they have not done prior to current injury or illness, continued to do during injury and illness, do less since your injury or illness, given up due to your injury or illness, and a new activity that you've done since your injury or illness. We are using the recovering version B of the activity card sort. So what I want you to do is look at these labels. So they have not done prior to current injury or illness, continued to do during injury and illness, do less since your injury or illness, given up due to your injury or illness, and a new activity that you've done since your injury or illness. And what I want you to do is look at each of these activity cards one at a time and place the card under the label. Place the card in the category that best describes your involvement with the activity. Do you understand?
Yes.
Okay. If you have any questions, let me know. Okay, great. Now, out of all these activities that you've sorted, can you please tell me from all the cards that you have seen, what activities are your favorite? Please name the 5 activities. These may be activities that you have given up
That are my favorite.
that are your favorite.
Spending time with friends.
Okay. We're going to go ahead and keep it in the same category.
Watching movies and watching television. Running.
Just pick one more.
Playing cards.
Okay, great. So now what I'm going to do is I'm just going to take a moment to score this activity, and then once we're done, we can probably work on making these some of your goals and working on some of these when we continue occupational therapy services, okay?
Sure.
All right, Mr. Campbell, now that we have scored and sorted the cards, we can see what we can work on in therapy, maybe working on some of the activities, finding a new way to do some of the activities that you used to do, or you do a little bit less that you still want to do after your injury. Do you have any questions?
No.
All right, great. We'll see you next time in therapy.
Thank you.
Thank you.
This is an example of the Activity Card Sort 2nd Edition, Recovering Version Form B. The institutional version, Form A, and the recovering version, Form B, measures the percentage of activities the client has retained since their injury or illness or admission. The community living version, Form C, measures the percentage of activities the client has retained since turning 60 years old. Forms B and C provide a global score for the percentage of activities the client has retained in all areas on the ACS. 3 suggestions to improve test validity are adding a never done category to the community living version Form C to take into account activities the client never participated in so you can get a more accurate global score. You could also update the cards to include a version with pictures of younger people participating in the activities. Another suggestion is to increase construct validity by validating the activities among other countries. 3 suggestions to improve reliability are to have a standard script of questions to ask involving the sort. Also, most of the test-retest reliability was completed with clients with a mean age of 74. Test-retest reliability could be improved by doing it with a younger client population. Also, you could have a standard method for the client to sort the card and pick their top favorite activities, as the 89 cards could easily get mixed up in a different category than it was originally placed.